Diabetes can present itself in a variety of forms, and its treatment varies depending on the type of diabetes diagnosed. In this training, we'll go over the most common types of diabetes, including prediabetes, type 1 diabetes, and type 2 diabetes. Other forms of diabetes are more rare and are genetic or associated with the presence of other diseases or the use of certain medications. Prediabetes is characterized by higher than normal blood sugar levels, but not high enough to establish a diabetes diagnosis. This condition is considered a wake-up call since it increases the risk of developing type 2 diabetes on the short term, as well as cardiovascular disease. This risk is increased with the presence of other factors including age, a larger waist size, and a sedentary lifestyle. Prediabetes is usually treated with lifestyle changes. A healthy and balanced diet and regular physical activity could help reduce the risk of developing type 2 diabetes or delay its onset. The same is true for cardiovascular disease. Type 1 and type 2 diabetes have specific characteristics that help to distinguish them and customize their treatments. People with diabetes need to know the type of diabetes that they have. Don't hesitate to clarify your condition with your doctor if needed. Type 1 diabetes accounts for around 10% of people with diabetes. It's usually diagnosed in childhood, adolescence, or early adulthood, but could also be diagnosed later on in life. It's characterized by the complete absence of insulin production by the pancreas. This lack of insulin deprives the body of its main energy source, the glucose. The body then turns to another energy source, the fat reserves. The breakdown of fats leads to the production of ketones, acidic substances that could lead to the development of diabetic ketoacidosis. This serious complication is often present when diagnosing type 1 diabetes. Diabetic ketoacidosis is treated by insulin injection. There is a family history of type 1 diabetes in 5 to 10% of cases. The main treatment components for type 1 diabetes include diet, physical activity, and insulin by injection or pump. Insulin is essential to the survival of people with type 1 diabetes. Type 2 diabetes is the most common form of diabetes and accounts for nearly 90% of cases. It's diagnosed usually in adulthood after 25 years of age, but could be diagnosed at a younger age as well. Excess weight or obesity are present in the majority of cases. The pancreas continues to produce insulin, which prevents the formation of ketones. There's a family history of type 2 diabetes in 75 to 90% of cases. Type 2 diabetes is treated by diet and physical activity. Sometimes, medications known as anti-hyperglycemic drugs may also be prescribed to help lower a person's blood sugar. Anti-hyperglycemic medications come in tablets or injection. Insulin may also be prescribed. The symptoms of diabetes include increased urine volume, increased appetite and thirst, fatigue and drowsiness, weight loss, visual disturbances, genital infections, tingling in the fingers and feet, and irritability. The signs are the result of hyperglycemia. The body tries to lower the amount of glucose in the blood by increasing the volume of urine, which increases thirst. The lack of glucose in the cells increases appetite and decreases energy, which causes fatigue and drowsiness. Weight loss may also result from the loss of fluid and glucose. Hyperglycemia may also present itself as visual disturbances, genital infections, tingling in the fingers and feet, and irritability as a result of glucose accumulated in the small blood vessels. However, in more than 1 in 2 cases of diabetes, no symptoms are present at the time of diagnosis. Sometimes, signs of diabetes complications that affect the heart or blood vessels may indicate that a person has had diabetes for some time without having any other symptoms. This is why it's very important to follow the recommended screening tests at age 40 or younger, depending on your risk of developing diabetes. This course has been made possible with the financial support of Hush Diabetes Care, a division of Hoffmann La Roche Limited.